Well, welcome to CATANet TV. I'm John Reid, the moderator for this CATA clip with David Farnes, our principal spokesman for healthcare. And David, I couldn't help but this morning in the Financial Post, I was reading the Conference Board of Canada ranked us 10th in 17 countries in terms of our healthcare performance. Yet we spend almost more money than anyone else. I think the US is the only one that outpaces us in spending. We all know the population is aging. We're getting less tax dollars. That seems to spell trouble. So my question to you is, why mobility healthcare now? Why is mobility healthcare important for Canada's innovation nation?
Well, yeah, thanks, John, for having me. You bang on with the article today in the Post. We, as a country, are spending more and more on healthcare as a percentage of our GDP, and there have been several recent studies indicating that for us to maintain our standard of living and drive productivity, we really need to focus on the healthcare sector and adopt technology to drive those cost efficiencies. The situation's getting worse, as you point out, because of the aging of population. So, for a country, we really do cost savings in the healthcare system. And I think as Canadians, we could enjoy a much better user experience when we either obtain healthcare services directly or even when we're working with our loved ones and caring for example, aging parents. I think in terms of an innovation nation, and we are an innovation nation, we're people that like to, for example, use our online banking services and use instant tellers. We like to eat what we innovate, but we're not doing that in the healthcare sector. And so, one of the purposes of this new board is to identify the obstacles that we're encountering with the adoption of mobile technology and figure out a solution to those obstacles.
Well, David, this is a CATA clip, so I want to have a call to action with each clip. You've given us some excellent context. You've given us the imperative for mobility healthcare. What is your specific call to action to the audience today?
My specific call to action is join us, get involved. Whether you're a practitioner trying to use mobile technology as you deliver healthcare services or care services, whether you're an application developer or a service provider, if you're encountering obstacles, join us, because we're going to work those obstacles. I've spoken to many individuals already. We've already identified 2 or 3 top issues, and there are synergies participate in the health during those issues. So please join us.
Okay, well, that ends the clip for today. I want to thank the audience for understanding during the clip. Obviously this is a beta technology, but I think David was able to convey the message, and the key thing here is work with him, work with us in advancing better health care for Canada. So thanks everyone for joining us, and stay tuned for the next clip.